Every year, over 5,000 people are killed on Britain's roads. Now, that's a frightening figure, and quite apart from the appalling implications in terms of heartache, there is a significant economic cost, estimated at over £3,000 million a year. But that figure also has to be seen in context. In 1927, for example, when this Bugatti was built, just as many people were being killed on the roads, although there were only a tenth of the cars about. In those days, it was largely pedestrians and cyclists and motorcyclists. These days, it's largely motorists. But the total figure was about the same. If there's one good thing to be said about those figures, it is that they're falling now when they were rising in the 1920s. Of course, the Department of Transport would like to see them fall even faster. They have a target of a 30% reduction over the next 10 years. But even so, they seem to be largely ignoring one method of preventing road deaths that's well proven on the continent. People are dying from road accidents because ambulances can't get the injured people to hospital quickly enough. Traffic congestion is the biggest problem. The government guidelines state that an ambulance should arrive within 15 minutes of call-out in 95% of all accidents. In London, the ambulances can't meet that standard.
The standard is perhaps a little silly in that 15 minutes, 14 minutes means very little. I think you would want to see somebody at the scene of an accident within 3 or 4 minutes rather than 15 minutes. So not only are they not meeting it, but the standards, in a sense, are really very low.
This could be the answer, the London Helicopter Emergency Service. It was formed 18 months ago, and the helicopter carries a doctor and a paramedic. That's an ambulance man with extended medical training.
The idea of an ambulance of this sort is to allow us to bring skilled medical attention to the roadside and then to give the patient at the roadside all the sort of attention they would normally get in a hospital.
What about the problem of landing the helicopter close enough to the accident spot?
It's surprising indeed how green London is when you take off above the line of housing. You find football fields and playing fields and so forth and places where you can land. So we only have difficulty in under 2% of cases in landing within 200 meters of the accident.
This month, this Dauphin helicopter became operational on the roof of the London Hospital in Whitechapel. It can reach an accident in central London within 4 minutes. Be at the scene of a crash on the M25 within 10 minutes, which could radically improve an injured person's chance of survival. An extended response time is not unique to London. Cornish Medical Services were the first to see the potential of using a helicopter. They introduced it 3 years ago. In contrast to London, they fly a small Messerschmitt Bolko, with 2 paramedics but no doctor. They believe specially trained paramedics are as effective as doctors at the scene of a crash.
048. 98, Gosforth, 4 vehicles involved.
There's traditionally been a problem in Cornwall because of the geography of the county and also the distance for patients to get to major treatment centres. In Cornwall, we only have one, which is based in Truro. The nearest one then is in Plymouth. So obviously, in terms of distance by land, the road journeys were considerably long, particularly in the summertime when there was very often traffic congestion, which made it almost impossible for land-based vehicles to get both to the scene and back to hospital.
And that's crucial. With an air ambulance, an accident on Bodmin Moor can be reached from the base in Truro within 10 minutes, and the return flight time is similar. By road, an ambulance could get there perhaps in 15 minutes, but it would then take 45 minutes to get to the hospital in Truro. So what difference does this really make to the patient?
We call the first hour after injury the golden hour because the mortality of the injured victim goes up by a factor of 3 times in the first half hour and then another 3 times in the second half hour without invasive medical action. Now, it is very seldom that there is invasive medical action in that first hour at the moment in this country. Abroad, things are very, very much different. People get to the accident site very much faster, but in this country, things are very poor.
Much of Europe and most states in the US are covered by well-established networks of air rescue helicopters. But Germany has the most developed service. In 1968, the motoring organisation ADAC launched an air rescue service to reduce road deaths. Now there are 36 helicopters which work together with the ambulance service to cover the whole of West Germany from 7 a.m. to sunset. They've flown over 300,000 missions and they claim that 40,000 people have been saved from death or permanent injury. a third of those were in road accidents. Medical studies show that a helicopter, as well as being quicker than a land ambulance, is also easier on the patient. It only accelerates and decelerates once. It has 9 times less vibration than its land equivalent. The result of all this is that the patient who gets there by air spends up to 7 days less in intensive care than a person brought in by road. That represents an enormous saving in both human and financial terms. Funding a system in Britain is proving difficult. Both the Cornish and the London services are paid for by charity. The people of Cornwall, for example, find £350,000 a year to keep their helicopter on call for 10 hours each day. The health service pays for the paramedics. By comparison, a land-based ambulance costs the health service just £21,000 for the vehicle alone. But a direct cost comparison is difficult because a helicopter can cover so much more ground more quickly.
Responding to an ambulance call in your division, Dartmoor, north of Haytor.
The medical services in Devon have provided an air rescue service, but only by joining forces with the police. This means that the helicopter is partially paid for by the Home Office, so no fundraising is needed. But the big disadvantage is the helicopter is not solely at the disposal of the ambulance service. Paramedics have to be collected when there's an incident, and this all bites into that precious golden hour. This scene in Switzerland is typical of so many in Britain, yet the chances of survival are so much better overseas. The question is, why is Britain 20 years behind? We estimate that just 18 helicopters could provide cover for the whole UK. Would it be prohibitively expensive? Well, it's estimated that it costs the country £600,000 every time someone is killed in a road accident. The results coming in from the limited air rescue services in Britain indicate that we could save 750 lives each year with a fully developed air ambulance service. So isn't it time that we developed such a coordinated scheme? And if the health service won't or can't afford to pay for it, then perhaps an insurance company or motoring organisation should take the initiative, as they have in Germany.